Dopamine is what we call a neurotransmitter, or sometimes it's referred to, it's very much like a hormone. It has hormone-like effects in the body. It sometimes gets grouped into and classed with hormones, but specifically neurologic effects and attention effects are part of it. Pleasure is associated with dopamine. Often when people feel pleasure, dopamine is significantly elevating in that moment.
Mm-hmm.
And we know that there's a base level, what we call a pool of dopamine or a tonic level of dopamine. And then there are phasic pulses of dopamine. And these phasic pulses are these ups and downs.
Welcome to the Soaring Child podcast, where parents of children with ADHD learn tips and tricks to help their child soar at home, at school, and in life. We feature interviews with experts, medical professionals, and parents just like you who are learning how to reduce ADHD symptoms using food and other natural strategies. Because children with ADHD deserve to soar just like every other child. I'm Dana Kay, your host. Hello, parents. This is Dana Kay here with another edition of the Soaring Child podcast. Now, you all know that we live in a world today where we are just so quick to label everything. But on the other hand, we're really slow to understand. This is not meant to be in a way that is, calling anyone out, but I think about this on a daily basis. I imagine a world, and I know that there's that world out there because this is what I live and breathe every day, but imagine a world where the root cause of ADHD or attention difficulties could be addressed with the same precision and care as we would apply to nurturing, a plant from the time we plant it, via a seed to when it blooms, or the same way that we care for our body when we're pregnant with our children. I just want you to ponder on that while we dive deep into today's episode. My next guest, Dr. Miles Nichols. He is not just a functional medicine doctor. He's someone who has walked the path of health challenges, and he's emerged with a determination to help others find their way through similar struggles. He focuses on Lyme disease, mold illness, gut health, thyroid dysfunction, and autoimmunity. Dr. Nichols has turned his personal battles into a professional crusade to uncover the underlying causes of these conditions. And I find that type of determination and motivation is definitely one that makes a doctor really go after the cause. Now, he is founding the Medicine with Heart Clinic in Colorado, to establishing an institute for educating doctors in functional medicine, which I didn't know, and I am really excited to hear about that. He also authored 2 pivotal books. Dr. Nichols has dedicated his life to this mission, and today he's here to share his unique perspective on the overlooked factors that contribute to ADHD and attention challenges in children. We're going to be talking about the silent triggers in our environment, the unseen forces in our body, and the untapped potential of functional medicine to make a real difference. Now it's time to welcome Dr. Miles Nichols to the Soaring Child. Hi, Dr. Miles. Thank you so much for joining us.
Hello, and thank you for having me.
I'm really, really excited for you to be here. And I love that you've got this personal story that really drives you in what you do on a daily basis.
Yeah. It's important for me to learn from what's happened in my own life and to share what I can with others, with parents, with children, and with individuals who are struggling with brain cognitive issues, things like ADHD.
Yeah, definitely. Look, I love how you look at disease through that different lens. So let's turn that lens onto ADHD. For our listeners, can you just sort of talk about some of the little, less appreciated contributing factors to attention challenges in children?
Yeah, and before I do, I'll just mention preparation for the episode. I was thinking about, while I didn't get the diagnosis myself, ADHD, I had teachers. I remember one teacher said, Miles, if I didn't know that you knew, if I didn't ask you the question, you could produce the answer, I'd think you weren't paying attention. And and I realized that I often looked distracted, appeared distracted, had my mind in a lot of different places, but and probably if the diagnostics had been a little better then than like they are now, I may have gotten the diagnosis, but I think I learned to manage it somehow. So without really thinking about it, but yeah, attention issues. It really I've come to appreciate them through many different lenses. One is that I went deep into spiritual practice and I learned about meditation. And meditation was a serious challenge for me, having a mind that goes in a lot of different directions, because it was something that they said a single object, a single focus. And I thought, whoa, a single focus, that seems so boring. And it seems so like how can I do that?
I 100% align with everything that you just said. I have exactly the same challenge, and I've always had that with meditation as well. And I remember starting to try and do it in my late 20s, and I'm like, "Oh my gosh, that is just so boring. My mind's just not going to focus on that one thing." So I actually like to hear when I do hear that from someone else. So thank you for sharing that with me.
Yeah, and I've been, I think, drawn to a moving meditation practice in part to be able to be moving while doing meditation. Although I've done plenty of sitting meditation retreats and practice and learned how to sit and focus, even though it wasn't natural to me. And I think that's part of where I've become interested in the brain, interested in mood, interested in neurotransmitters. In fact, last year I ran a summit called Microbes and Mental Health, and we were talking a lot about the aspects of how things like neurotransmitters and mood relationships and attention aren't as clear cut as I think science has and the media has conveyed for a while. And there's some contrasting information, and there's some triggers for neuroinflammation that may play a bigger role, I think, in attention issues than a lot of people appreciate, because a lot of people do focus so much on neurotransmitters, which I too, dopamine's important, serotonin's important. These neurotransmitters are absolutely important in how the brain perceives attention and becomes distracted. And I do appreciate that. And I'd like to share. I'm happy to talk about that if it's relevant, but I'd really like to share about some things that I think are less appreciated about the way in which the brain impacts dopamine and neuroinflammation can impact attention.
Yeah, no, I would love you to dive deep into that part of it because, we talk a lot about the little unappreciated things that that go on in our society today when it comes to ADHD, when it comes to mood, when it comes to attention. And so, let's dive into that.
So obviously there's a lot of variables at play, and a lot of them are social and dietary and lifestyle and sleep and all this. I'm sure lots of people on your podcast have talked about that. So I also won't spend a ton of time going there, other than to mention, of course, these are big things. I was in a time growing up where video games started to become popular. I spent far too many hours in front of a computer and TV playing video games, and then social media, phones, things like this have become so prevalent that it is really a culture in which there's addiction, and there's serious addiction to distraction, and dopamine's a huge role in that. So what I'd like to take a step back to look at and share with people is that how other than the cultural conditioning, other than things like screens and devices and things that are probably talked about a lot, how else might the dopamine system become compromised, the attention system become compromised? And one of the fascinating things that I've started doing in lab testing is looking at antibodies against dopamine receptors in the brain. And when we see dopamine receptors in the brain, we have dopamine receptor 1 and dopamine receptor 2. And it is not uncommon at all that I find, especially in children and adults with attention issues, that there's antibodies, meaning the immune system has created an attack against dopamine receptors. And it's actually pretty clear in research now that there are some triggers. There's some known triggers that can cause and be the initiating onset of why the immune system would start to attack dopamine receptors. And what we found is that if we treat those causes, that we do see that those dopamine receptor antibodies come down in almost every case. I've seen it time and time again that those antibodies come down. Now, what does that mean? Well, if the immune system is attacking dopamine receptors less, then there are more dopamine receptors that the brain is able to make. Because when the immune system are attacking the receptors, the expression of those receptors goes down. As the immune system lightens that attack, the expression of those receptors can increase, and the same pool of available dopamine can have more effect on those receptor sites. So without even changing dopamine at all, we can change the way in which dopamine impacts mood, focus, and drive.
Wow. And I think that this is definitely a topic that we have not explored at all for listeners in this podcast. So I'm super excited to learn more. So yeah, tell us about, what are those things that are going to start creating those antibodies that are attacking that dopamine receptors?
Well, I think the ones that maybe listeners have heard of the most are PANDAS and PANS. So pediatric, autoimmune, acute onset, neuropsychiatric disorder. This is caused by strep, or PANS is a broader than just strep. It can be many different organisms that can contribute to the onset of this neuropsychiatric autoimmune condition. And that's a fancy way of saying there are psychiatric symptoms and it's an autoimmune mechanism of action, and that the trigger was an infection. We've learned in research since those diagnoses that there are quite a number of toxins and infections both, and changes in gut microbiome, all that can contribute to what we would call a broader term of encephalopathy, which is going to be, encephalopathy is just a term that's used to describe functional or structural changes in the brain. This becomes especially true for behavior changes that seemed to occur almost without a trauma, without an explanation of, it wasn't like someone died. It wasn't like parents got divorced and it was a super stressful time. It was like, it was the middle of a school year. Nothing super significant happened, normal stresses of day-to-day life. And all of a sudden, behavior changes, attention issues, and struggles. If that's the case, I see so often that we have had some trigger for onset of encephalopathy, and toxin or infection triggers are the most common. Gut triggers are possible as well.
Yeah, definitely. We've had a couple of episodes on PANS and PANDAS, but I love the way that you explain it, and you're explaining it in a very sort of different lens, as we started out than the guests that we've had on the podcast. Curious, just inside your practice, are you using like the Neural Zoomer Plus or the Cunningham panel to determine those infections in the brain?
Yeah, both of those. The Neural Zoomer Plus is the go-to because we have 48 autoantibodies on that.
Yep.
The Cunningham, we have 5, but the Cunningham's quite good as well.
Yeah.
So yes, we'll use those, and I've started to notice some patterns, and certainly dopamine receptor 1 is more common than 2 to be attacked. And then sometimes that goes together with contact and associated protein 2 and a couple of other tubulin antibodies are not uncommon, and there are a couple of other antibody elevations that we see quite frequently. And I'm seeing a lot of glycine antibody elevations as well. Glycine is an amino acid that's considered non-essential because the body can make some. However, if you just follow the trend and look at all the people consuming bone broth and collagen protein powders and looking at things, that you can see that there's a trend towards extra glycine. Collagen is rich in glycine. Bone broth is rich in glycine. Grass-fed beef gelatin is rich in glycine. And the reason is that it appears as though glycine has a calming effect in the brain. It also seems that it has an effect for temperature regulation. It can improve sleep. It's also part of bile salt formation, and that's important for detoxification. And toxin are one of the triggers we're talking about here today. And it's also something that we find to be, if there is a lot of glutamate activity, if there is a lot of neuroexcitatory impact on the brain, if there is a lot of neuroinflammation, we do find glycine to be helpful, and a glycine antibody is going to really impact that.
Mm-hmm.
So one of the things that I see is that for many children and for many people struggling with attention issues, that higher doses of glycine are paired together with looking at causes of toxins, infections, and other things can be quite useful. And I don't see it talked about so often. So I wanted to mention that.
No, it's very, very interesting. Well, let's sort of dive into sort of how can these sort of environmental or infections really contribute to altering the function and even sometimes structures of the brain?
Yeah. So when we look at the research on encephalopathy, and specifically, there are some papers entitled Post-Infectious Encephalopathy.
Yeah.
And if we look at the organisms that are listed in research there, we do see there are bacteria, there are parasites, there are fungi, there are things that make toxins, molds, and things that would produce toxin byproducts. And in fact, many of these infections, even if they don't produce a compound that's toxic, even on their cell wall of gram-negative bacteria is something called lipopolysaccharide, which is an endotoxin and is toxic in and of itself. I can't tell you how many children will do a stool test or a sinus swab or both, and we'll find strep colonized. Strep can colonize in the gut, and strep can colonize in the sinuses. So that's one that we see quite regularly colonizing in the body. A lot of people think that you get strep and you get strep throat and then it's gone. Unfortunately, some strep really can and does for some individuals stick around, and that may be in the sinuses, gut, or both. And if both aren't done, unfortunately, what I see is that sometimes people find it in the gut, treat it, but they didn't address it in the sinuses. And of course, then postnasal drip, and you actually can reinfect the gut. And people maybe feel better for a little bit, or they get a little bit of headway, and then there's a slip back. And I always ask, have you tested the sinuses too? And have you seen if there's an issue there as well? And we're starting to see a lot with a certain kind of these Corynebacterium, these actinomycetes, these are starting to become quite prevalent. And in fact, they can infect the skin, and they are initiating a chronic inflammatory response. And I think they're incredibly underappreciated right now. They can live in homes, and there are ones that can habitate in humans, and there are ones that won't habitate in humans, and that are environmental and aren't so much of a problem. But the ones that can habitate in humans, we actually see a big problem there. And we're seeing them colonize, and we're seeing them live on the skin, and we're seeing them initiate chronic inflammatory response systemically and neuroinflammation in the brain, and being a trigger for dopamine receptor antibodies and other antibodies against brain tissue and or other mechanisms by which it can contribute to brain changes, dopamine changes, attention changes. So,
sorry, go ahead.
Yeah. So there's a lot of infections. Some of the most common, the actinos are one that I think are underappreciated and very, very, very common. There are endotoxins from bacteria that we sometimes find environmentally.
Just explain to listeners what endotoxins are.
Yeah. So as I mentioned, gram-negative bacteria in their cell wall have something called lipopolysaccharide, or LPS. We know if we inject dead E. coli, there are studies where we inject dead E. coli IV, just put it straight into the bloodstream. People get very sick very quickly because of what's on the cell wall. And that lipopolysaccharide is something that the immune system tags and triggers as a threat, and the liver must remove. And that removal by the liver, it has an inflammatory byproduct, and we see a significant inflammation, also with leaky gut and intestinal permeability. we see a lot of the bacteria in the gut get into the bloodstream, and we can see a flood of lipopolysaccharide or LPS post meals sometimes. So we'll also see that contribute to this inflammatory response. And the environmental ones are really bad when we see that there are, after water damage or after certain sewage or other things or dirt can collect these bacteria, and these bacteria can be, if they're gram negative, they can have this endotoxin in their cell wall, and you can actually breathe that in, and it can actually go directly into the bloodstream through the lungs. And then that can be a source that is independent of anything going on in the gut or the body as well. And that's an important one.
Yeah, look, I think I think what this is showing and showing to listeners is, look, I talk a lot about on the podcast about inflammation driving ADHD symptoms. And so, Dr. Miles here today is really getting deep down and dirty on what that actually means. And so there's probably a lot of words out there that the listeners today are like, whoa, whoa, whoa. But don't you trust Dr. Miles with all these words that are coming out of his mouth? But this all makes sense to me. We look a lot at leaky gut. We see a lot of those antibodies to the LPS in when we do like a wheat zoomer through Vibrant Wellness and stuff like that. And so when you've got those LPS antibodies in your body, you know that that bacteria, that those endotoxins and everything are getting into that bloodstream, and they're causing that inflammation. And so if you've got that in your environment, and you're breathing it in, then that's getting into your body, that's contributing. But I don't want listeners to get worried or scared. There are things that can be done. I think that this is just really highlighting that ADHD is not always what it seems. And I hope that if you've been listening here at this podcast for a while, you definitely know that already. Now, dopamine is a huge buzzword that a lot of people talk about in ADHD. And I'm going on a tangent here. There's a lot of people that glorify ADHD on TikTok these days. And ADHD is real, 100%. Do all the people that are diagnosed with ADHD have ADHD? Probably not. Now, I think that dopamine is one of those words that's thrown around a lot, but we haven't really dived into what is dopamine and, what role does it sort of play in that attention, regulation. And so, Dr. Miles, you are one smart fella, and I think that, our listeners would love to hear from you about, what is it? Why might that be, how does it play into that attention regulation? Why might that be sort of a super important part for parents of children with ADHD to understand?
Sure. Happy to dive into dopamine a little bit. So dopamine is what we call a neurotransmitter, or sometimes it's referred to, it's very much like a hormone. It has hormone-like effects in the body. It sometimes gets grouped into and classed with hormones, but specifically neurologic effects and attention effects are part of it. Pleasure is associated with dopamine. Often when people feel pleasure, dopamine is significantly elevating in that moment. Mm-hmm. And we know that dopamine there's a base level, what we call a pool of dopamine or a tonic level of dopamine. And then there are phasic pulses of dopamine. And these phasic pulses are these ups and downs. In fact, people who know dopamine the best sometimes are marketers, advertisers, big, Las Vegas. Las Vegas knows dopamine very well because
very well.
I think they may be a lot of neuroscientists who help the casinos figure out the lights, the dinging, the things that will trigger the reward systems in the brain. In some ways, we can think of dopamine as part of the reward system of the brain. And the reward system of the brain is rewarding things that may give energy. And that's unfortunately, historically, we're biologically and evolutionarily coming out of genetics that might favor survival from carbohydrates. And this might trigger, for example, sugars to spike a phasic pulse in that dopamine system, and that feels pleasurable to people. Also, there are sensory perceptions. So that's why these lights, these dinging sounds, even phones, a ding, attention from another person often can trigger a dopamine response. Dopamine is this. If we think about this tonic pool, this level that we have, and then we think about these phasic pulses responding to the environment. The response to the environment is going to be, let's say your phone dings for a new message or an email that comes through. There's a little pulse of dopamine. Now, if your tonic level is up here and that pulse goes like this, it doesn't draw your attention away because your pool is higher than the pulse was. This is overly simplified, by the way, but it's just helpful to understand.
Yeah, I think so. And I think listeners will definitely appreciate it.
So let's say, the tonic pool is a little higher, then a small pulse won't draw my attention away from what I'm focused on. In fact, we could say that for some people who get so rigidly focused on something and can't, it's sort of like they can't move their attention away.
Hyperfocus. Yep.
Yeah. So then we might have an issue where the tonic level is so high that it takes a huge pulse to draw someone's attention off of what they're currently engaged in. By the flip side, there can be a lower level where even minor pulses of dopamine can draw the attention away from what a person's doing. So there's this background, baseline, tonic, pool kind of a level of dopamine. And then there are phasic pulses in response to stimulus in the environment and in response to foods and chemicals and other things that are happening in the body and in the brain. And it's a little bit complex how it all plays together, but the essence of it is your attention staying on what you're on, or is it moving to something else? And once it moves to something else, how quickly can it come back to what you were on, or how quickly might it get onto something else, to something else, to something else, to something else? So that can maybe help listeners understand a little bit about how the level that, especially that pool of dopamine, may be impacted in attention issues, and that those phasic pulses also, they can be impacted, and it can take more and more stimulus over time, especially if those receptor sites are down because there's an attack against dopamine receptor and there are less receptor sites. Mm-hmm. It can start to impact how much stimulation there needs to be to draw the attention away. And we can see kids, the parents are saying the name of the kid and the kid's just almost not responding, as if it's not even registering. And we see this a lot. And we see this zoning in and lost sometimes, and other times when the stimulus outside is a little different, then we see this super hyper distractibility, unable to stay with one thing.
And I think that's really important, the fundamentals of it to understand. And I think what I'd love to quickly jump onto is, sugar. I mean, you touched on that, and how when you eat sugar, it can give you that dopamine rush. And we hear a lot of kiddos with ADHD are sugar junkies. Can you explain that concept?
Yeah, it's almost like to get the pleasure from dopamine, you do need to have that phasic pulse go above that line. And so as the response becomes blunted because of hyper stimulation and of the dopamine system, which the reward system is so well known in media, advertising, in the world today, that by computer programmers, and I mean, it's integrated. People have learned a bit about how to activate this reward system because, consumerism, any business wants to activate the reward system to get the attention, right? Attention is money when it comes to consumerism and business. And so there is just an absurd amount comparatively to 100 years ago, 50 years ago. There's just an insane amount of stimulation, of activation of reward system, and it's making it just like when when people get insulin resistant because they're eating too much sugar, that's a separate issue, but that's more like the blood sugar levels are going high. So insulin has to put that sugar into the cells, and too much insulin over too long a time can start to create what we call an insulin resistance. And we can start to see, pre-diabetes and even diabetes. And it's very sad, but more juvenile diabetes these days. And what we see is that aside from that whole blood sugar, when we're talking about dopamine, we see a similar kind of a blunted type of response, or a kind of, it takes more and more and more stimulus to drive the pleasure and the motivation. Yeah.
Yep. Yep. And it's sort of like, when your child eats something with sugar, they get that hit. And then as they eat more and more, it's kind of like that base level that you explained, it becomes higher. And so those pulses, they need more of that sugar to go above that baseline. Definitely that sugar is driven by eating more and more sugar. And so sometimes you got to cut it out. And it's not fun when you start that. But once you get over the hump, it can be definitely beneficial. Now, for families that may think that dopamine, that there's an issue with dopamine, what lab testing, do you, I know we touched on a couple, are there any other lab testing available to sort of assess that brain function, that dopamine, and structure changes that contribute to those attention issues?
Yeah, there are some neurotransmitter tests that are not accurate. So you have to be careful when you're looking directly at neurotransmitter testing. And some labs have even been prosecuted and gone out of business for this. So I just exert caution when it comes to looking at things like neurotransmitters, catecholamines on lab testing directly. There are some decent labs, but make sure you're working with someone who really knows the research and is looking at it, because sometimes people do unfortunately make meaning out of labs that don't have validation in terms of neurotransmitters specifically. When it comes to antibodies against dopamine, we talked about the Neuralzoomer Plus, we talked about Cunningham panel. Those are two that measure antibodies against dopamine receptors. That doesn't measure the level of dopamine specifically. And because the levels of dopamine are so variant, going up and down, it's less valuable to get a snapshot in time level of dopamine. There are precursors to dopamine, and there are nutrients, and we can look at nutrient testing. I find nutrient testing to be quite helpful in giving us a bit of a sense for the dopamine system. We can look at some of the precursor amino acids. We can look at tryptophan. We can look at also some urinary metabolites that tell us a little bit about the dopamine response. So an organic acids test or NutriEval or something along those lines, a micronutrients test can be quite useful, especially if it's doing some of the urinary metabolites. So that's one of my favorites in terms of looking at the dopamine response as well. And methylation plays an important role also. And I like to look at methylation markers. That's going to be homocysteine in the blood. And then also there are some urinary and blood panels that can give some insight into methylation, B vitamins, choline, creatine, and that whole system. It can, when dysregulated, impact mood, impact brain function, impact dopamine as well. And then additional testing are going to be the things that can trigger the antibodies, especially if the antibodies are present. That's going to be infection antibodies. Stool testing, is strep congregating in the stool? It might be sinus swab to see, do we have infections in the sinuses? And we might do environmental testing. We might take a dust sample from the home. Do we have endotoxin? Do we have actinos? Do we have, of course, mold? People know about mold a little bit, I think. So do we have toxin from mold or bacteria? Do we have these harboring in the body antibodies against these organisms? And then we can look in the urine at toxins as well and see what's excreting in the urine. And we know that plastics are a big issue too. We see that these are endocrine disrupting and these are hormone disrupting, and they do impact the hormone and endocrine chain, and they probably impact the brain as well. And that research is limited right now when it comes to directly looking at dopamine and exposures to plastics. But we see so many plastics coming out in urine. Microplastics in urine in some cases are as much as in the gram amounts per week in some studies, which is almost like one study showed as much as 5 grams a week, which is like a credit card a week worth of microplastics coming out in the urine.
Wow.
And that's just, it can't be good for the hormone system in the brain and regulating. Yeah.
Exactly. Well, I mean, Miles, you've shared so much with families today, and all I want to say to listeners out there: Rome wasn't built in a day. You don't need to take every bit of information that you've received today and start to get overwhelmed by it, because, there are definitely practitioners out there just like, Dr. Miles, who really will help you follow a step-by-step process and, just take those small steps forward. And so it is this, it can be, once you start going into this world of natural health, it can seem overwhelming, but it's just remember that Rome wasn't built in a day. Just these small, slow steps will help you get to where you need to go. Dr. Miles, why don't we finish off with, just some of those initial small steps that parents can take at home based on everything you've shared today?
Yeah. First, if diet isn't dialed, if sleep's not there, if there's overuse of electronics and some of these basics, I don't recommend going into the nuances of detailed labs when those basics haven't been addressed.
100%.
First, really, get the sugar out, get some of the things that are highly processed and refined out, and reduce the inflammatory oils and do some basics there. A next layer after diet and stress and sleep and electronic use and stimulation, after those have been addressed, that's like a tier one foundational first. Then looking at, okay, what's been what's the collateral damage from some of that stuff having been off, or just in general the world today and the toxic levels in the world today. And I think a next layer that's really helpful for people is to go into gut function, to look at a stool test and see things going on in the stool, and a sinus swab. I like to, when we're doing the stool test, because then we can see sinus and stool together.
Yes.
And then a next tier up from that would be to look at the brain antibodies, to look at the organic acids and nutrient profiles, and to start to fine tune the diet that way, and start to understand about the environment that you're living in, and sending a dust sample off from the home, from the school, and starting to get a sense for what exposures are there, both infectious internally and toxin externally. So those are a couple of things. At home test for toxins would be a VCS test, a visual contrast sensitivity test, depending how old the child is and what they can do with that. A VCS test is an online test that can be useful in some cases to get a sense, because we know that visual contrast is impaired with exposure to some toxins and infections. So a VCS test, or vcstest.com, is one place to get it. Survivingmold.com has it as well. Those, and I don't have any affiliations with them other than that I like use them. Yeah, the patients. And so those are that's just an easy, simple, pretty accurate test to do from home without a provider. And you can also order the dust samples. Envirobiomics is a great company. You can order dust samples from, I like their panel 7, does the endotoxins and the actinos, and looks at 5 most toxic molds. So those are all things that parents can start to investigate and do at home. And then once they find a provider, the stool testing and the sinus swab, and then some of the more complex tests after that.
I loved how you laid that out in, really starting with the basics and then moving into, the next level and the next level, because, there are families out there that start with the basics and you would be surprised 40 to 50% of them don't need to go further. As humans, we feel like we need the evidence from the tests that, we have to go down this path. But, in all the families that I've taught over the years in reducing ADHD symptoms naturally, I would say that 40 to 50%, we fix the basics, we fix the diet, we fix the home environment. And so many of those ADHD symptoms get better because the basics, the gut starts to heal, the toxins start to, get out of the body, and we start to reduce that inflammatory load. So I really loved how you sort of laid it out for listeners today. Dr. Miles, thank you so much for joining me and definitely sharing your experience, your passion with all of our listeners today. Please tell listeners where they can find and follow you online.
The easiest place is medicinewithheart.com. That's going to have a free blog. We have lots of information that comes out on that blog on various health topics. And it also has a button where you can book a call with staff in the clinic if you're curious to understand more about the clinic, and it's got links out to other places. So that's the best place, is medicinewithheart.com is sort of the central resource that you can find, or hub that you can find everything else from. And I'll end by saying I really, my heart goes out to families, to children. I had my own, my father passed when I was 15, and I really had some things that I wished I'd been able to do together with him, and to sometimes spending time together, quality time, doing some things like breath work and movement practices. Also, we didn't mention those. I just want to mention that those things can go a long way too. I think they get some attention, but not quite enough attention, and really caring and doing some activities together that are fun, that are engaging, and that are mindful in nature, meditative in nature, even if they're active, I think can be quite useful. So medicinewithheart.com to find out more. And thank you everyone for having me.
Thank you, Dr. Miles, once again for joining me today. Now, listeners, if you enjoyed this episode, if it gave you sort of new ideas and help you see things differently, we'd love to hear about it. We'd also be so extremely grateful if you left a review for our podcast. Your thoughts not only help us grow and, branch off into other areas, but also they offer hope to so many parents out there that are looking for answers. So let's really keep sharing knowledge and supporting each other. Listeners, thank you for tuning into this week's episode of The Soaring Child. I'm Dana Kate, your ADHD health practitioner. Keep on thriving. Thank you for listening to the Soaring Child podcast today. To learn more about how to help your child with ADHD soar using natural strategies, visit our website at adhdthriveinstitute.com and follow us on social media at ADHD Thrive Institute.